Welcome to NHC Advantage 2024 Model of Care Training. NHC Advantage is our institutional special needs Medicare Advantage plan that we offer to long-term care patients in our center. Our population in long-term care is very different than the seniors the typical Medicare Advantage plan serves. CMS-approved institutional special needs plans to deliver specialized care to patients living in a skilled nursing facility. NHC Advantage gives us the opportunity to give our long-term care patients additional benefits, health resources, and specialized care in our center. NHC Advantage members are still in the Medicare program. They do not lose their Medicare. They still have Medicare rights, protections, and benefits. They receive complete Medicare Part A, Part B, and Part D prescription drug coverage. An NHC Advantage member can choose another Medicare plan or return to original Medicare if they are not satisfied with NHC Advantage at any time of the year. NHC Advantage has achieved a CMS 5-star rating, signifying the highest quality of care and service. In 2024, our benefits extend to cover essential Part C benefits, along with supplemental offerings such as vision, hearing, dental, podiatry, and introduce new benefits like over-the-counter and beauty shop visits for an enhanced healthcare experience. We understand that coordinated healthcare improves the care of our long-term care patients. NHC Advantage supports these patients with multiple comorbidities that require close monitoring and may need help with 5 or more ADLs. Our plan contracts with a network of providers, facilities, ancillary service providers, specialists, and hospitals to provide care and treatment of our NHC Advantage patients. Our NHC nurse practitioners complete health risk assessments and face-to-face visits with members. They meet with our center team to review each NHC Advantage patient's individualized care plan. Our quality goals are to reduce non-essential hospital admissions, treat the patient in the center, and maintain the patient's optimal level of function and prevent acute episodes. CMS allows us to use Skill in Place with our NHC Advantage patients. Skill in Place is an elevated level of care provided in the center where the member resides as an alternative to a hospital admission. Our NHC Advantage nurse practitioner and your clinical team will work together to start the appropriate intervention like Skill in Place when appropriate to avoid a trip to the hospital for our patient. How do I know who is NHC Advantage patient? When you look at a patient record in Matrix Care, there will be a purple banner that says NHC Advantage under their picture. Every month, the center rosters of members are emailed automatically to the center. The center needs to add the NHC Advantage banner to the patient face sheet. Notify Plan NP of transfers. Please make sure to notify your NHC Advantage nurse practitioner if your patient is transferred to the hospital during your shift. CMS requires our NHC Advantage NPs to visit a NHC Advantage patient within 7 days of returning from a hospital stay. When a patient needs an appointment, please visit the NHC Advantage website for a listing of in-network providers. If the provider is not in the network, please let your NHC Advantage account manager know. Our NHC Advantage contracting team can work with the individual provider to see our patient even though they are not currently contracted with the plan. Each center has a lead for NHC Advantage called the Center Champion. The Center Champion performs outreach to the responsible party to obtain a Permission to Contact, or PTC. The NHC Advantage sales agent reaches out to the patient or responsible party. If they are interested in enrolling, the sales agent will contact them 48 hours after the first contact. The sales agent submits applications to CMS for processing. If approved, the member will be active for the first of the month following their signature date. NHC Advantage must be notified as quickly as possible of any discharge to home or the community. This triggers an out-of-area involuntary disenrollment. Members are given the chance to regain eligibility within 30 days of being notified of their pending disenrollment. If eligibility is not regained, the member will be disenrolled the last day of the month. NHC Advantage also needs notification when a member passes away. This notification helps us follow up with the appropriate groups when CMS has not processed the data timely. The NHC Advantage website is a great resource for locating in-network providers. If you cannot find a provider, please reach out to your NHC Advantage account manager. The Liberty Dental website provides a list of in-network dental providers. You can also nominate dental providers through this site to become in-network providers. Notice of Medicare non-coverage is provided after a skill-in-place stay and skilled stay after a hospitalization for NHC Advantage patients. Authorization is required for a skill-in-place SIP stay. NHC Advantage will authorize a certain number of days. A NOMNIC will be sent by NHC Advantage to the center contact. The NOMNIC is issued at least 2 business days ahead of time. No authorization is required for a post-acute skilled stay. The center social worker will issue the NOMNIC once the patient no longer meets skilled criteria and will keep the NOMNIC on file. Each center will utilize the NHC provider portal called QNXT. There is additional training on the NHC provider portal in Relias. The center receives a capitation payment per member per month. The skill-in-place rate is paid for each approved day. The quality incentive will be paid each quarter, and the population health incentive will be paid annually. These are electronically processed each month. Thank you for completing this training today. We appreciate you taking time to learn about our institutional special needs plan and how we can support our long-term care patients with NHC Advantage.